Okay, you are live. It looks like, let me double check on your page.
Awesome. Welcome,
Now,
everyone. Oh,
don't forget to, there's still a delay, but don't forget to read your disclaimer and you're going to do great. I'm going to chime
thank
off of
you.
here.
Welcome, everyone. Welcome to the Endo Channel. I am so excited for tonight's live. We have the wonderful Jyoti Patel, Dr. Jyoti Patel, and she is going to be sharing her passion with all of us. I'm super excited to ignite this within our community because knowledge is power, awareness is key. Welcome, Doctor.
Thank you, Brittany. I'm honored to be here.
So before we get started, I would like to read a disclaimer for everyone that is watching. Here on the Endo Channel, we are about educating. So anything that you hear on this broadcast is not intended to be substituted for medical treatment. All cases vary and do require individual case review. All topics discussed are educational for educational purpose only. Please speak to your doctor regarding your individual case. By participating in this discussion, you do understand and agree to these terms. Welcome to the live. Now, before we jump right in, guys, I would like to ask of you to share this. Share this to your page, to your groups that you manage. Invite your friends, your family, ones. Dr. Jyoti Patel, let's jump right into it.
Great.
First question for you. How long have you been in practice of internal and integrative medicine?
So, Brittany, I finished residency, which is medical training, in 2003. And so I've been practicing internal medicine, pediatrics, and integrative medicine since 2016. Actually, for 16 years, since 2003. So 16 years of primary care, outpatient medicine. And a lot of times patients don't know what internal medicine actually means. Internal medicine is actual specialty where after 4 years of medical school, a doctor can choose to take a 3-year residency training. We go into the hospitals. If you ever get admitted to the hospital, you will meet an internist. If you're on the wards, if you're in the ICU, if you're in the cardiac care unit, you'll meet an internist. If you're in the office and you need a general physical or you're sick, you may meet an internist. And then after that, if an internist wants to subspecialize, they can do additional training to become a cardiologist who specializes in heart disease, or a pulmonologist who specializes in lung disease, or a gastroenterologist who specializes in the stomach. I decided to do a 2-year fellowship in integrative medicine. What that means is the understanding that all your organs inside your body, whether it's your brain, your heart, your lungs, your gastrointestinal tract, your reproductive tracts, they don't work in silos. They're actually one big unit working together. And they talk and communicate with each other. And understanding how the whole body works and how all organ systems matter. Not only that, but what you see, hear, smell, taste, touch, feel, think, the people you surround yourself with, the environment that you're in, all of it communicates with the inside organs, causing you to either thrive and be healthy, or signals stress, causing inflammation and causing sickness. So integrative medicine is integrating both conventional medicine with a more holistic, natural approach to help put the patient in the center of their health, and then partnering with them to teach them how their body works, where maybe the dysfunction happened, and how we can put that together. So I'm hoping today that we'll have a great chance to talk to your audience and give them some tips on how they can improve their own health and give them power to take back control of their health. Because just like you said, awareness is the path to wellness. And I truly believe that. So thank you for saying that.
Yes, absolutely. And thank you. I love seeing your passion for what you do. It's so contagious and inspiring. So thank you. I want to know, where did your soul fire come from with this? What made you rise up in this line of work?
Yeah. So I think we all have a calling in life, and we know what we were destined to be here for, or some of us are still searching that. And I knew early on that I loved working with people, and I loved helping people, and I loved connecting with people. So I decided to stray from the normal path, and I became a solo medical practitioner. I have been practicing on my own for the last 16 years. I'm a small town doc. I love sitting in the room with my patients, getting to know them. I treat 2, 3, 4 generations of families. I know their grandchildren, their great-grandchildren, their parents. I get to know the whole community. I'm the only pediatrician in town. I'm the only female internist in town. So when I walk through the local grocery store, I get to know my patients so well, they know me. So that's really where my soul fire comes from. I love helping people. I love being and connecting with people. I love being in the room and listening to their stories, and really being able to help people with my passion. I felt like in the traditional sense of medicine, that spark or that feeling has been lost. And as we corporatize medicine and how physicians have lost autonomy and insurance companies have dictated terms of care, that doctor-patient relationship has really withered away. And I still have this strong passion to maintain and to connect and to feel good about what I do. So you asked me where my soul fire comes from. It just comes from, I think, your sense of purpose and passion. That's where it is.
I love it. I love it. And I know that our community can definitely relate with the different doctors. A lot of them are still seeking the proper ones, and they go through as 10 years on average before they even receive a diagnosis or proper treatment, pointed in the right direction. They're in there for 5 minutes and then, they have a diagnosis or, a medication to take home. So to hear that is so refreshing. Thank you. So tell us, when different souls come to you seeking freedom, what are they seeking freedom from? Because you did mention whenever we first met that you have dealt with some endometriosis cases, but chronic diseases, what others have you seen and have treated?
So I see myself as the Sherlock Holmes of medicine. I am a detective. And I love detective work when it comes to the human body because I'm fascinated by it. It's an amazing, intricate, organizational system that is self-renewing and self-repairing if we put it in the right environment. So the kinds of patients I treat are patients that have chronic diseases. So there may be women and children or women and teenage girls coming in with fertility issues, endometriosis, PCOS, early ovarian failure, or I might have adults coming with diabetes and heart disease and autoimmune crisis or even cancers. I even have small children that come in because they have behavioral disorders, ADHD, autism. So it's the same in the gamut, from end to end. I take every patient and listen to their story. I try to find out what their journey has been. What has their environment been through childhood to now? How did that disease ensue? Where did things go wrong? And I always tell my patients, it's like standing on 10 thumbtacks. If you just work on nutrition and you just take out one thumbtack, you're still standing on 9 thumbtacks. So when I talk about chronic disease and reversing chronic disease, I want to look at the full gamut. What is the nutrition like? What is their social stressors like? What are their relationships like? Do they have passion in life? What is their stress levels like? What do they sleep like? All of these things come together to cause wellness or illness. What do? I take care of every patient that comes to my clinic, look at their chronic diseases, try to find out where nutritionally or physiologically things went wrong, and then I partner with them to kind of give them a plan. Here's where we need to start, and this is where we want to be. And let's work together with what's working to get you back to health. I might do functional medicine testing, gut testing for gut permeability. I might do nutritional testing to see if they have nutritional deficiencies. I might do food sensitivity or allergy testing. I might do toxin testing, mold testing. Might do other more extensive hormonal and inflammatory panels that the primary care doctor may not have time or the luxury of ordering. And then come together with the patient, try to figure out what is it that they want to do out of this? What do they want to get out of it? Because they're the driver of this ship. I'm simply the guide. I'm the vessel that's going to get them there. So we work together on getting them back in balance. Whatever the underlying root causes, we try to peel back the layers to find out why they've gotten sick and how we can get them back well.
Love it. Absolutely love it. Okay. So I do want to move on to sharing with our community something amazing that you are doing and spearheaded, I read, yourself. You are extremely passionate about educating souls on using food, okay? Using food as medicine. And in doing so, you created a 2.5 acreage
Yes.
um, a community garden. So I want you to share about this jaw-dropping garden because it's in Fountain Hills, Arizona. It's 120 organic raised beds, food donation program, a farm to table education program, and y'all, the town even awarded her the Volunteer of the Year award just this past year in 2018. So I want to know, how did this come to pass and how is it changing lives? And what is your heart's continued vision or mission for it?
So this is a great story. So thank you for letting me share it. I have a patient who is a Girl Scout. She was 10 years old at the time. And she had to interview someone as a role model. She wants to become a pediatrician one day. So she asked me if she could interview me, and I was honored. And she asked me all the standard questions. Why did you go into medicine? How long did it take you? All the easy answers. But then she asked me a heart-provoking question. What do you do for community service? And, I was like, well, I give public talks, I donate my time and, the usual. But I started to think about that. Here I am, I'm passionate about medicine. I'm passionate about education. I love my patients. I want them to be healthy. I teach them about food as medicine. What can I do? What can I do as an individual to bring this to the larger community? And it came to me, a community garden in my town, a place, a safe green space where we can grow food together, where we could be out in nature, where we could be in the sun and the soil, we could be with our friends and our family and our neighbors, where we can reconnect with what's real. We can nourish our body in a meaningful way, and we can get that pride of growing something from scratch and consuming it and teaching each other what we know. I mean, that was what the vision was. And I believe that there was definitely some divine intervention that came through that vision, and the right people came to me at the right time, that collectively we were able to bring this garden to life. And it truly is a live thing. There's over 300 residents that garden there. We do have a farm to table education area where we have chefs coming in to do teaching on how to prepare healthy foods. We have 120 raised organic beds where we grow produce. We donate to the local food bank. We have kids gardening beds. We have beehives. We have compost programs. And it's just growing. My vision with that is that as we start to touch more and more lives, it's like putting a pebble in a pond and it causes this ripple effect. I'm hoping that that one person that hears this and thinks, I can do that in my neighborhood, or I can do that for my family. We can have a small raised bed and start growing our own vegetables or herbs. That's what I want. I want everybody to start thinking about how is it that I can cultivate wellness within myself, within my family and my loved ones, and the people around me. So if we can do it here in Fountain Hills, I know everyone else can.
Absolutely. You know, my husband, whenever I told him about this has been a dream of his that he would love to be able to do. One day, I'm telling you, one day, the Endo Channel, we're going to come out there and we're going to, and I would love to share with everyone what you have going on out there, because it truly is something amazing. And
Would love it.
I'm very excited that you sparked that. And I think that you are right. It's going to spark it within other people. So thank you. Okay, so I do want to switch gears a little bit. Let's talk a little bit about the connection, right? What everyone's here for, that connection between trauma and chronic disease. But before we do that, I want everyone to understand, what is somatic tissue?
Okay, so I love talking about the human body. Your cells, tissues, and organs, what makes up your skin, your muscles, your bones, your brain, your heart, lungs, kidneys, internal organs, that's somatic tissue. But what brings your somatic tissue to life, right? What's the difference between somebody who is alive and somebody's dead? Because you can have a dead body and have all the same organs. But what makes that body alive? That's energy and intelligence. that is wired through the entire body. That intelligence and energy and that information is what sparks life. So when we think about somatic tissue, whether it's our brain, our reproductive organs, our heart, lungs, any of those tissues, they're constantly changing. But think about it, the lining of your stomach turns over every 2 to 3 days. Your skin turns over every 2 weeks. Your red blood cells turn over every 90 days. So nothing in your body is static. Even though we see this as a solid substance, it's actually constantly evolving and changing. And how does it change? It changes because of the information that it receives. That information is in the form of food that you eat. It's what you see, what you hear, what you taste, what you touch, the experiences that you have, the thoughts that you have, the people and the nature around you. Everything is information. And as that information touches the surface of the cell, it signals the cell to tell the book of life, which is your DNA, what chapter it needs to read. And then your DNA opens that chapter and interprets that information and sends out proteins to form what you see, which is symptoms or wellness, okay? So your somatic tissue is receiving that information and storing this information. Whatever experiences you've had in the past, if you were a child and you experienced trauma, if you're an adult and you had a traumatic surgery or an illness, if you experienced divorce or separation or heartache, all of that information that your body has received at some point is stored in your body, in your somatic tissue. We think of the brain as the only place where information is stored, but that's incorrect. Information is stored in every cell of your body. 50 trillion cells are listening all the time to your thoughts, to what you see, hear, smell, feel, touch, think, experience. And they're taking that and then deciding what to do with it. And that book of life that you inherited from your parents and they inherited from their parents was passed down to you for you to survive. When you read a chapter that tells your body that you're in distress, that you're stressed, that you've been traumatized, then your body will fight, flight, or freeze to help survive that traumatic experience. If that traumatic experience gets stuck, that information gets stuck in your tissues and you haven't let it go, then it continues to send out that message that you need to fight, flight, or freeze. And you start to have coping behaviors and you start to have experiences, and then your cells start to experience stress, and then inflammation ensues. And then you can see those cells are sick, that causes the tissues and the organs to get sick. And then that occurs as you as an organism also experience illness. Does that make sense?
It does. Absolutely, it does. And I'm really glad that you touched on a lot of things, actually. Over in the Endo Circle, I try to share some of these things that I've walked through organically, and I've seen a lot of it in hindsight. And so to hear you say it, it just really does bring it home. And thank you. And so with that, I would like you to move into sharing how unraveling our trauma story, like you were saying, you're saying that if we unravel our trauma story, the trapped suffering in our somatic tissue can be released, correct?
Correct.
In the process of that, how far do you take it in your practice? Is that something that you educate them on their environment, mindfulness, things of that nature? Or is it something that y'all can dive deep in together?
So trauma training is a specific specialty. So when somebody comes in with serious trauma, so for instance, in the 1990s, they did this big study called the Adverse Childhood Event Study. It was a study on 17,000 adults. They asked them 10 questions about childhood trauma, whether it was abuse, physical, sexual, verbal abuse, whether it was abandonment, neglect, divorce, parent with mental illness, or a parent with substance abuse, parent who was incarcerated, or witnessing domestic violence. They looked at that spectrum of adults that had endured childhood trauma. And interestingly enough, this is the landmark study that connects the mind to the body. And they found that the more questions that you answered yes to, the higher the propensity of you developing chronic disease in the body, in the somatic tissue, like heart disease and cancer and lung disease. And even we are talking about endometriosis and chronic pain syndromes. All of those things were linked highly, not just mental disorders like anxiety and depression that people think of or substance abuse, but physical ailments were directly tied to these traumatic problems. So in our clinic, we do try to unravel the story. And there's a great book called The Trauma Heart by Judy Crane. And something that she says, when you unravel the trauma story, the behaviors make sense. When you unravel the trauma story, your behaviors make sense, but also the behaviors of the people that took care of you, that loved you, and the behaviors of people around you. So for true healing to start, you have to unravel the trauma story. What I do with my patients is I sit down with them and we create a timeline from maybe even during pregnancy, what their mom was enduring, or what they experienced as a child and what happened during adolescence. What are some of the landmark times in their life where they experienced sadness, trauma, or joy? Where was the turning point in their health? So we do talk about unraveling that trauma story because I believe awareness is the path to wellness. So when the person becomes aware, aha, the perfect storm, I had these stressors, I had this traumatic event happened, my parents got divorced, I felt abandoned, I had issues with eating disorders, I had a breakup with a spouse or a boyfriend, this happened to me, I got sick. That's awareness. So we do help them unravel that story. But Brittany, from that point on, if somebody needs some deeper work, I do recommend trauma therapists. I do have an integrative mental health specialist in my clinic, and I will refer that patient to work more deeper at a deeper level with her. She also helps with meditation and mindfulness. I send people out for EMDR, which is eye movement desensitization. So we do that as well. We also have a course that we offer in MBSR, Mindful-Based Stress Reduction. It's by John Kabat-Zinn. It's an 8-week mindfulness program, which has a lot of studies behind it to show that it helps with reversal of underrooting trauma. If somebody needs acupuncture, they need to see a counselor, they want to do CBT therapy, they need to do somatic therapy. We actually have a psychologist that works with horses and animals to help people with trauma, and that's huge. Because animals have this unconditional love, and I hear you're animal, so I know that you are an animal lover as well. So animals have this unconditional love that they can give you, and that's sometimes what people are looking for, especially trauma survivors. So we talk about somatic therapy. So there's many aspects to treating somebody who has somatic trauma, who has endured trauma in the past. But first is just unraveling the story for them, showing them where the distress comes from, maybe combining that with tests so they can see where the system is failing them, maybe looking for nutritional deficiencies or gut imbalances or dysbiosis in their microbiome, helping them cultivate a good nutritional practice, maybe a good movement practice, maybe working on sleep hygiene, maybe cultivating those relationships that are causing them stress, or trying to help them find time to self-care. Because it's not uncommon that when you endure stress, you disassociate, you separate yourself from yourself, and you start to project outward. You don't want to look inward. You become distracted by things and doing, and you don't want to look inward. And so a lot of what we do is try to help them with that self-care. So it's really not just one thing. It's a combination of so many things that we do. And I know that I'm not a one-person show. I need to also reach out to a community of like-minded medical practitioners that believe in holistic, comprehensive medical care, whether it's traditional, conventional medicine with prescriptions and surgeries, or combining that with spiritual work, nutritional work, lifestyle choices, and helping cultivate this really nice garden, let's say, of things that the patient can do. So it's a whole thing, the whole thing.
Absolutely. So I wanted you to elaborate a little bit on some of the practices that these incredible souls can be doing, today, starting at home. That's mind-body practices like mindfulness, meditation, and breath work. Can you maybe touch on a few tips and tricks for them?
Absolutely. So the first thing is I always recommend people start with a 10-minute silence practice. Silence meaning sitting in a comfortable place by yourself in your thoughts and letting the thoughts come freely without judgment, but with curiosity. And I believe me, after 2 weeks of sitting in silence for 10 minutes, you will start to cultivate this amazing practice of self-realization. You start to see and reflect. And what used to have power over you, the things that you feared, start to become less fearful. Second is I tell people to cultivate a meditation practice. And the easiest way to do that is to learn how to do deep breathing exercises. One of the easiest exercises I teach my patients is 4, 7, 8. You take in a deep breath through your nose for a count of 4. You hold your breath for a count of 7. And then you open your mouth and you exhale out for a count of 8. 4, 7, 8. You can also envision a ball of light and breathe in as that ball expands and breathe out as that ball contracts. If you're more a logical person, you can think of a box. And as you breathe in, you slide your thoughts up at the side of the box. You hold your breath as you go across. You exhale as you go down, and you hold as you go across. You can also do finger breathing. Breathe in, exhale out. Breathe in, exhale out. I do like this a lot because it kind of combines that tactile touch, keeps your mind engaged in the physical activity as you're doing your work. So breathing, the reason why breathing works is it actually shuts down the part of the brain that makes you fight or flight. So when you're in fight or flight and your heart is racing, your mouth is dry, your pupils are dilated, your chest is pounding, your hands are clammy, you're finding yourself racing in thoughts. Try doing 6 to 8 deep breaths, whether you use the 4-7-8 technique, the light ball technique, the box technique, or you use the finger breath. The most important thing is that you breathe with your belly. So think of it as you're filling up a glass of water with your breath. So your belly fills up, then your chest up to your neck. And then as you exhale, you take the breath out of your chest first and then your belly. So you balloon out your belly like a big beach ball, and you bring your navel to your spine. So proper breath work actually activates the parasympathetic nervous system, and it helps downregulate the sympathetic system, which is the fight or flight, and it allows you to have control like a Zen master. So now your nervous system hasn't gone rogue on you. You are the master of your nervous system. So if you practice breathing every day, twice a day, then when you're faced with a challenge, or when you're faced with bad news, or you're faced with something stressful, your body automatically and intuitively knows what it needs to do to de-escalate. So 10-minute sitting practice, meditation practices using breath work, and then gratitude practices. Sometimes we get caught up in the negative thought, the treadmill of thoughts where we're constantly thinking bad things are going to happen, or we're thinking about the bad things that have happened. If we take a small space in our lives and we focus on gratitude, we have fresh air, we have fresh water, we have loved ones, we have a place to sleep, we have a roof over our heads. We're blessed with so many things. When we refocus our energies, you're actually firing the parts of the brain called the hippocampus and the prefrontal cortex that upregulates serotonin and dopamine, making you feel happy. And it shuts off the amygdala, which makes you feel stressed. The gratitude practice is another thing I encourage people to do.
Those are wonderful. Thank you for sharing that. Those are fantastic. And Endo family, I hope you were listening and taking notes because we will be going over that in the Endo Circle on Wednesday. Those are wonderful. Okay, so when we first met, Doctor, you told me that you had treated a couple of souls or a few souls of endometriosis. And so I'm just really curious as to what symptoms that their particular case, because as we all know, every case is different, not one the same, what type of symptoms they were presenting and what it was that y'all did to bring them, I guess, peace and what the outcome was.
Yeah, so it's very important to say every case is individual and unique. No two people are alike. I had a young lady who was in her 30s, and she started to have heavy periods when she was 16. And she, as you had mentioned earlier, had seen several doctors along the way, heavy, painful periods, debilitating, put on birth control pills throughout her life. She got married. She wanted to have children. She had difficulty getting pregnant. So she was dealing with some infertility issues. Her regular gynecologist sort of dismissed the issue, which created a lot of stress and distress for her. She finally made it to the right doctor, who did a laparoscopic evaluation and diagnosed her with endometriosis. And subsequently, she underwent some fertility treatments and was blessed with twins. Following, yes, it was great.
That's great.
Wonderful, beautiful, and patients as well. So she came in and she wanted to do something more. So this is a type A professional woman, highly stressed, a tiger mom, definitely protective, but puts a lot on her own shoulders. She's stressed, she eats poorly, she doesn't sleep very well, and she still has irregular, heavy bleeding cycles. So what we did was we started out with again, partnering with my patient. We did some nutritional testing. We checked for food sensitivities and allergies. We looked for gut permeability. We looked for nutritional deficiencies like vitamins and minerals. And interestingly enough, we found that she was sensitive to several things that she was still eating in her diet. And she had gut permeability issues, which for people that don't know that, the gut can become porous and toxins can seep into the body. And if your gut microbiome, which is the bacteria in your colon, is not healthy, it can cause sickness in the system. So what we decided to do, Brittany, is we removed the foods that she was sensitive to. We rotated other foods into her diet. We replaced a lot of the nutrients and the bacteria that she needed in her gut. But most importantly, we worked on her mindset, her attitude, down-regulating that stress response, that fight or flight. We worked on cultivating a self-care practice. We talked about proper sleep hygiene. She was having some marital stress. We talked about how to approach that in a more meaningful, loving way. We talked about taking breaks from work because she was an overachiever and she puts a lot on herself. That also is a trauma-related symptom when you find yourself becoming overly busy and overly achieving and seeking approval. That in itself comes from a place of trauma. So we did a little bit of that as well. And I was so joyous because she came back 30 days later and her period symptoms had significantly improved. And she looked at me and she cried. She said, "Oh my God, has this been the problem all along?" She's been dealing with this for decades and she felt the best that she had felt. And she just she couldn't believe that was the answer. Sometimes it's something simple, and she couldn't believe that just by resetting her lifestyle and her balance and her approach and her mindset and taking care of herself, that in itself would have shifted things. I have another patient that's in her late 40s. She too had heavy menorrhagia since she was a teenager. She too went through an infertility, had her daughter at 45. And she has now had 3 endometrial ablations for menorrhagia. So for those who don't know what endometrial ablations is, it's a procedure where they sort of cauterize the inside lining of the uterus to keep it from bleeding. And so she'd had multiple procedures. She was a diabetic, she had high cholesterol, she was high stress and executive, working very long hours, having trouble sleep. Again, very similar pattern. Long story short, we changed her diet. We talked about xenoestrogens. Xenoestrogens are basically chemicals that act like estrogen in our food and in our environment. So this can be makeup, this could be body care, skincare products such as parabens and sulfites. It can be pesticides that are sprayed on our food. It could be plastic that's found, like BPA is a xenoestrogen. So these hormones that come from food, right, from animals that are injected with hormones, or additives that look like hormones to the body, can disrupt normal hormonal cycles. So by cleaning up her diet, the second thing I talked to her about was her insulin levels. Insulin is a pro-growth hormone. Cortisol is a pro-growth hormone. When your sugar is dysregulated and when your stress levels are dysregulated, inevitably your hormonal balance, your female hormonal balance, your estrogen, progesterone, and testosterone is going to become dysregulated. So we worked on controlling her blood sugar. We worked on reducing her stress. We worked on helping her sleep better. And again, she came back with the same feedback. My symptoms have improved dramatically. But here's the thing about humans. We like to test the theories, right? So both of these ladies did cheat and went back to the old ways. And you know what was magical about that? That their symptoms reminded them that they needed to take better care of themselves and honor their body. And when they have that awareness, when they go back to their old ways and they start stressing and not sleeping and eating poorly, and their symptoms come back, there's this new awareness, there's this connection I can't create for them. They had to create it themselves. All of a sudden, it makes sense. And now they also have hope, and they know that the choice is theirs. They have to choose to want to be better. And once they start taking that journey, then there's no stopping them, right?
Mm-hmm.
So that's what's lovely about my job. When I get to see that somebody has just finally, that light bulb has gone on and they've embraced that change, and now they're in the driver's seat and they're telling their friends and they're telling their colleagues and their coworkers, it's that ripple in the pond again. I love it.
Yes, I love that too. Those are great stories. And I'm so happy that they have found relief and awareness. That's where it happened for me too. So I can completely relate with going back to your old lifestyle, or even a type of food or something as simple as that. And it really does make a difference. But yet you're mindful of it and you're like, oh, okay, well, I can live without that. So let's get back on something good. So, okay, so I'm really interested in this question. Believing in pushback. Have you come across this in your years of practice? You know, different souls just maybe not believing in the simplicity of it versus, surgeries and heavy medications and things like that.
I think that that's where modern medicine is right now. We've thrown the baby out with the bathwater. We as physicians too are taught and trained that if somebody has a symptom, we have to put a diagnosis to it, and that diagnosis has only one solution, a medication or a procedure. We're trained, and I think I'm going to say brainwashed, to think that that's the only line that we have. We've forgotten about all the tools in our tool belt, all the things, that wisdom that has been passed on through ancient civilizations, through cultures that have over 5,000-10,000 years learned different things within the body. So patients are just in the same boat. They're looking for an answer. They're going to their expert, their physician. They're asking them, what is it that I can do? And the answer that they have received is, here's the prescription. So it's not their fault. It's really just what we as a culture have cultivated. And I do have patients that do that. Despite my open-mindedness and my desire to want to help people in a holistic way, I do come across patients that are fearful of change. Change is difficult. Staying the same is easy. When you fear that if you stay the same, it's going to kill you, that's when you will change. And that realization only comes from that person, whether it's stopping smoking, whether it's giving up alcohol, whether it's giving up drugs, whether it's giving up sugar, whether it's giving up a particular type of lifestyle. Until you realize that what that's doing is killing you, you're not going to make the change. No doctor is going to get you to change that. You have to want to change it yourself. I have this quick story on that, Brittany. I have this lady, she had vascular disease, heart disease. She had multiple blocked arteries. She'd had a 4-vessel bypass. She'd been to 10 cardiologists. They had put her on multiple cholesterol lowering medications. She didn't tolerate them. She didn't want to take them. She came to see me. So, me, I was like, okay, challenge accepted. So I thought of it, and I put her on what's called the Dr. Ornish plan. Dr. Ornish has published multiple studies showing that diet, nutrition, and lifestyle can reverse heart disease, reverse it. Medicare actually pays for Dr. Ornish's diet because it's validated by science. It's evidence-based. So I put her on the Dr. Ornish plan. Within 30 days, her cholesterol and her inflammatory numbers dropped significantly. Her cholesterol was over 400, went down below 200. I was like a kid at Christmas. I couldn't wait for her to come in. I wanted to high five her. I wanted to tell her how great she was doing. And you know what? She looked me in the eyes, Brittany, and she said, I'd rather commit suicide than eat this way. And she goes, I just can't do it, Doc. And she went back to her lifestyle, and her cholesterol and her inflammatory numbers went back up. She went to the Mayo Clinic, and she got put on a medication that used to cost $14,000 a year, right? So Repatha, which is a cholesterol lowering medication, she was put on that, and she was having side effects from it. And she called me about it. And my answer to her is, I'm only a vessel of knowledge. I'm only a guide. You have to take the path. You have to see that this is possible. And yes, sacrifices need to be made. The industry doesn't make it easy. Food, it comes readily available. It's tempting. It tastes good. It's easy, right? It's convenient. That's why they put it out there. We have to choose differently for ourselves. If we're eating chemicals, dyes, pesticides, processed food, refined flour, grain, and sugars, and it's causing us inflammation and disease, and we see that, then it's up to us to make that final decision whether we want to continue it or not. Right? So yes, there are people that still need to experience that change to believe that something as simple as diet can play a huge role in reversing chronic disease.
Wow. So that story hits home for myself and for this community. I know for a fact. I choose to make these changes, and I have for 5 years now, and it's been life-changing. And it's something I try to share and ignite inside other souls in different ways online, but especially over in the Endo circle. And I know that there's pushback, and I know that there's that hesitation from some. And so it's just refreshing to hear, one, they're not alone, and I want them to understand that, because I was there, I was there, and you're the woman you shared about was there, and there's strength and support. So you mentioned earlier about surrounding yourself with like-minded souls, and that I cannot say enough to our community, because we are stronger than what it is we're fighting. It's just about awareness and just every single day making that choice, which is us, choosing us over convenience and things like that. So. Okay, I do want to, let's see, I did want to ask you, I did have Joy chime in a moment ago. Quick reminder, everyone that's watching live, Joy is in the comments. If you have something that you want Dr. Patel to answer for you directly here on our live, make sure to drop your question below, and Joy will make sure to get that over to me. Joy did chime in a moment ago, and she wanted me to have you, and we'll do this at the very end once we wrap our questions, but she wanted me to have you elaborate more on the diaphragmatic breathing and pelvic floor. Now, this is huge, pelvic floor issues with women with endometriosis. So we'll touch base on that in a moment.
Yes, absolutely.
Awesome. So, okay, so you might have kind of touched this in a few of the stories that you said. Everyone is different too. So not sure how much more you can elaborate on this question, but on average, how long would you say it takes for a patient to start seeing results from recommended treatments?
Right. So everyone is very unique. And I think that it's that thumbtack rule again. You're standing on 10 thumbtacks. You take out one thumbtack, you're still standing on 9 thumbtacks. So sometimes that process, you are here, you want to be here. It may take a step closer and a step closer and a step closer and a step closer. And that process can take 30 days, it could take 90 days, it could take several years for some people to really embrace this change and start seeing changes in their body. Everybody's cellular mechanism is different. You detoxify differently than I do. If I consume a toxin, it may linger in my body a lot longer. If that same toxin is ingested by you, you might clear it that same day. So we are very unique in how quickly our cells repair. We're very unique in how quickly we turn over and change genetic material. We're also unique in all the other circumstances in our life. You may have a very stressful marital life, and that's putting pressure on you from the inside. And it's hard for you, even if you're eating right and doing yoga and meditating and all the self-care, but you've got this underseething current of marital stress, or you've got an elderly parent that you're caring for, or you have a demanding boss. So there may be so many other things, other factors that keep you from recovering faster than someone else. So it's not a competition. And it's not a race, it's a slow marathon, right? It's not a quick, I'm going to get better and now I'm going to go back to my life. It's, I'm going to cultivate a lifestyle to maintain balance, right? So we want to keep our body in balance. And it's like on a teeter-totter. Some days good, some days bad. Some days really rocking it, feeling great around the right people, getting the right energy, feeling the groove. And some days just want to stay in bed and take a break. And whatever that balance looks like for you that day or that moment, it's changing. And you just have to learn how to feel yourself. And this is something I tell my patients. Your body, she was with you when you were born. She's going to be with you till the end. She only has you to love her and take care of her. She counts on you to give her unconditional love. When you get mad at her, when you loathe her, when you're angry at her for not being well, when you can't accept her the way she is, she gets sicker and sadder. You're in this together, right? We're in this together. Your body is you. Take good care of her. Be with her. And even when she's suffering, even when she's sick, love her nonetheless. That's when she needs extra love from you. And when we do that, it allows us to kind of create balance in our life. So when you say how quickly do people turn around, it's a journey. And anywhere from a few days to years, sometimes it can take somebody to come to full realization of accepting themselves and their body, understanding the trauma that they've been through, understanding how their body responds to food. And food is not good or bad. It's just the food serves you or it doesn't serve you. It either ignites inflammation or it doesn't. And your friend may say, you know, I can't eat gluten, but you might say, I do fine with gluten. I eat dairy, you don't eat dairy. You know, it's all these different nuances. That's what makes our body unique. And the best thing that I can do for my patients is help them learn about themselves. They are unique, beautiful, soulful beings. They come with their own experiences, their own energy, their own intelligence. Understanding that, accepting it, loving it, and then cultivating a good environment for it to grow and foster and thrive, that's what we're working on.
I love it. And I love you. Oh my goodness. Good stuff. We did have a question come in from the audience. I will get to that and after this next question. Since we're on the subject of food, I want to continue right quick into this next question. So for the endometriosis community, inflammation, right? It's an inflammatory disease. So what would you say, in your professional opinion, is the number one food to combat inflammation? Now, I know you just said that it's different for everyone, but is there something like celery juice? I know, that's something that could be helpful on this.
Yeah, so here's what I tell people about that. Hippocrates said thousands of years ago that the root of all disease stems in the gut, right? So all diseases start in the gut. And what they didn't know back then, that we know now, is that we're not alone. In our colon, we have trillions and trillions of bacteria and organisms that make us up. We are more bacterial DNA than we are human DNA. We're more bacterial DNA than human DNA. That microbiome is the reason why we regulate inflammation, why we regulate nutritional balance, why we regulate neurotransmitters and mood balance and hormonal balance and immune balance. They're the life source. When you don't have a good, healthy gut microbiome, we have found through scientific data that it causes inflammation in the body. And that inflammation can manifest as endometriosis. It can manifest as cardiovascular disease. It can manifest as cancer. It can manifest as gastrointestinal diseases, even Parkinson's, brain diseases, autism. Everything has been linked to a poor gut microbiome. So if I had like one wish and I had to do one thing to help people with their inflammation, it's to help reset their gut. So their gut microbiome is really critical and important. These bacteria act as soldiers. They are lining the gut lining. They're protecting us. They're breaking down nutrients. They're removing toxins. They're fighting pathogens and parasites, bacteria and yeast. They're creating a shield to keep inflammation from seeping inside our bodies. There's a biofilm and also a cell lining that keeps everything outside of us. When we kill off the gut microbiome by eating a lot of pesticide-laden, preservative-laden, chemical-laden foods, we're killing that gut microbiome. When we kill that gut microbiome, there's nothing protecting our lining. Also, that gut microbiome helps us break down nutrients. It helps us produce B12 and vitamin K. It helps us fight off pathogens. It also feeds the lining, short-chain fatty acids. And so when we kill off this gut microbiome, you have this open window, open door for pathogens, toxins, chemicals to seep inside the bowel wall. So when I talk about food, I first say, feed your microbiome. And your microbiome loves fiber. Anything fibrous is going to facilitate, flourish, and thrive your microbiome. And when your microbiome is growing and robust and diverse and healthy, then nothing is going to get in the way of your health. It's going to help protect you. It's going to help regulate your hormones. It's going to help you detoxify. It's going to help you set your immune system on the right path. It's going to decrease inflammation. So fiber is the key when it comes to the gut microbiome. A lot of people ask me, Brittany, can I take a probiotic? It's not the same as eating fermented food that have live cultures in it. We talked about gardening. If you grow your own food, just gently wash your food and then eat your food. That soil has good microbiome on it. That's the bacteria that helps us flourish. If you go to a farmer's market and you have somebody growing food organically, gently rinse your vegetables. Those are great sources of good microbiome. If you like yogurt, kefir, kombucha, sauerkraut, kimchi, miso, anything fermented, all of those foods are great for the microbiome. And then lots of fiber, 6 to 8 cups of vegetables or fruit with skin on them. Fiber helps feed the microbiome. If you like to eat animal foods, like animal matter, just make sure they too have been grass-fed. They too have been wild-caught, because when they eat from the earth, all the good nutrients from the earth gets into their meat matter, and that's what's going to help nourish you. When we eat preservatives, pesticides, chemicals, dyes, colors, chemicals that are sprayed on our food, it kills the gut microbiome. Those toxins and pesticides seep into our tissue, and they cause the immune system to get ignited, which leads to inflammation. So that was a really long answer. Sorry about that.
No, do not ever apologize for elaborating. That's fantastic. No, thank you. Thank you for that. Okay, let's move on to Amy's question. Amy, thank you for your question. If anyone else has any, please drop them below and Joy will get those over to me. But Amy asks, do you believe that pushback resistance to change is trauma related too?
Yes, absolutely. So when we go back to somebody who's been traumatized, let's say you've suffered from abuse, abandonment, neglect, or any social ills while you were growing up, and your perception of that as a child is that you're not worthy, that you're not lovable, that you're discardable, that people have abandoned you because you weren't important, you weren't intelligent, or you weren't special. Then what happens is we develop coping behaviors and we become defensive, or we become frightened and we run away, or we shield ourselves by numbing ourselves, and we start to avoid everything that has to do with our bodies. We become disconnected. And disconnection is a way of protecting ourselves from our suffering. And we don't want to see that, because looking inward and seeing that causes us to see that pain that we suffered. And when we see that pain, it doesn't make us feel good. So we protect ourselves with these coping behaviors. And yes, absolutely right, Amy. When you find yourself or anyone else finds themselves not wanting to see the reality of what's going on, it's because you're protecting yourself from the pain. What if you start peeling back the layers and you start re-exploring, not in a safe place with a trained provider, you start re-exploring that trauma and it reignites that same painful experience? That's not good for us, and our bodies know that, and they protect us by creating these defenses. So that's why if you have suffered from trauma, or you are dealing with some type of previous event, childhood adverse event, work with a trained provider so that you feel comfortable peeling back those layers, understanding as an adult with compassion, reparenting that younger self, saying to yourself, self, you were just a child. This was something that happened to you. It wasn't your fault. You are lovable. You are light. You are joy. You are beautiful. I love you, and you are worthy, and you are deserving of love just like everyone else. Once you come to that conclusion and you reprogram yourself to believe that you are worthy and you are loved, and this was not your fault, that this was put upon you, and this is now, you are in this present moment that was a long time ago. You are stronger and braver now, and you are resilient, and you had to do what you had to do to survive. If you created these barriers, if you created this defense, if you put on this shield, if you put on this mask, it was to help protect you. But now you are safe and you are loved, and it's okay to let that go. And letting go of that trauma, letting go of that message that was tethered to you, that's where true healing starts. And sometimes people need to do that physically. They need to do that in community, like your Endo Channel, coming together with people in a safe environment that understand you without judgment, without shame, without guilt, without remorse, without sadness, but with joy, to say, thank you for listening. Thank you for being there for me. And this is my story, and you validated me. Once you feel validated and you can let go of that past, that's where that journey starts. And sometimes that needs to happen before you start to make changes in your lifestyle. Because I've had patients that will, march through this way. They will log obsessively. They will control their diet. They will work out like fiends. They have every part of their life mapped out because they fear change. That's a sign of trauma too, because change in their life signified loss. Change in their parents' relationship caused divorce. Change meant that they had to move away. Change meant that their parent left them. And when you experience that change, it causes fear, right? And you don't want things to change because that brings back old memories of when change was tethered to pain. Untethering that and allowing yourself to see that change can be good, change can be healing, and you are worthy of change. That's where the healing starts.
That was beautiful. Thank you. Okay, we do have another question from Amy. She is asking, is gut microbiome also negatively affected by her years of pain medicine?
Yes, absolutely. There's multiple studies to show the connection between prescription medications, pain medications, and disruption of the gut microbiome. Antibiotics obviously go to the top of the list, right? So if you're taking lots of multiple doses of antibiotics, I've seen children get prescribed antibiotics for acne for years, and there's been lots of published data to show that it correlates with inflammatory bowel diseases as they get older. So disruption of the gut microbiome causes chronic diseases of the gut. It also can cause inflammatory diseases. We know there's a connection between poor gut microbiome and inflammatory diseases such as the heart. Cleveland Heart Lab does a blood test called the TMAO, and that's a byproduct of bad bacteria in your colon, and they find it in the arteries of heart patients. So we know there's a huge connection. So medications such as antibiotics disrupt the gut microbiome. Pain medications disrupt the gut microbiome. Acid reducing medications like proton pump inhibitors destroy the gut microbiome. There are so many medications that disrupt. So I'm not saying medication is bad. I'm saying use it sparingly and know that it's not a long-term solution. It should be used for acute reasons when needed. And then let's try to find the root cause of why the body is distressed and where the pain and inflammation is coming from, and identify some of the things that might be causing the balance to get disrupted, and then walk ourselves back to that. And use medication in the meantime to bridge you so that you can live comfortably. But yes, medication is a big part of that. Stress too. Cortisol causes disruption of the gut microbiome. So it's not just toxins in our environment, not only medications, also supplements. Sometimes patients will come in with a bag of 12 to 15 supplements because they try to supplement away a bad diet, and you can't supplement away a bad diet. And all those supplements have fillers, binders, chemicals, additives, heavy metals. All of these things that we take, we think they're natural and good, could be causing disruption of our gut microbiome. So be very careful. If you do want to take a supplement, just like a medication, seek professional help. Go to a medical doctor that's trained in learning how to dispense supplements and vitamins and nutraceuticals, and make sure you're taking the right kind. Read ingredients. Make sure that there's not a lot of fillers and binders in the ingredients. Look for that. Look at the nutritional label. See if it has the right amount of nutrients that you're looking for. Look for seals of approval, things like GMP and USP and NSF. Those are third-party testers, making sure that your supplement has been tested and screened for purity. Look for things like that. Because anytime you put a chemical in your body, whether it's a prescription medication or a supplement, it has the potential to disrupt the balance.
Great questions, Amy. Thank you for submitting those in. If anyone else is wanting to submit a question, and please drop it below while we still have Dr. Patel with us. I do have a statement from B. She says that, is it kefir is great? Kefir is great, but the vinegar and such burns. Speaking of gut biome health.
Yeah. So again, here's the important part about taking in bacteria. If your gut is unhealthy, it's inflamed, it's leaky, and you don't eat enough fiber and there's deficiencies in that, and you add more bacteria into the colon, it can sometimes actually cause disruption. So a lot of times patients will take a probiotic or probiotic food and it causes gastrointestinal problems. There are conditions called small bowel intestinal overgrowth, SIBO, where your colon gets infected with yeast and bad bacteria. And if you eat food that's fermented like kefir or fermented vinegar, it can actually cause your gastrointestinal symptoms to get worse. So that's why I like to sometimes, if somebody does try to take a probiotic food like kefir and it causes them distress, sometimes I take a step back, I look back at the big picture. I may do a test to see if their gut bacteria is imbalanced and they have an overgrowth of yeast or bad bacteria before I tell them to take a probiotic or take a fermented food. I put them on a short FODMAP diet. FODMAP stands for fermentable oligo monosaccharide foods, polyols. So these are foods that are highly fermented. If we take those out for 30 to 60 days, we can clear the infection, then have them try the kefir, then have them try the fermented vinegars, and that might do you a little bit better. So yeah, sometimes you have to tweak that's why we as physicians can sometimes take a step back and tweak it if the probiotic isn't working.
Awesome. Let's take a step back just one moment. Amy is asking you to revisit the test you mentioned. There was a test that they can take at the Mayo Clinic. We were referring to years of pain meds affecting the microbiome.
So there are several tests that you can get. You can actually don't have to do it at the Mayo Clinic. There are specialty labs that will do testing for the gut microbiome. There are many labs on the market now. There are kits that you can take home and do a stool test and look to see whether your good bacteria and your bad bacteria are under control. You can see if you're malabsorbing nutrients such as proteins and fats. You can look for inflammation markers in your colon, like EPX and IgA elevations. You can also look for short chain fatty acids. You can look for pathogens, parasites, and yeast in your bowel. I think the test that maybe Amy was talking about was the Cleveland lab, and that's the acronym is TMAO. And that's a blood test that the Cleveland lab has. It's called Cleveland Heart Lab. You can actually get that test now at Sonora Quest Labs as well. Sonora Quest Labs, the Quest Labs just bought out Cleveland Labs. So now you can get that at a local Sonora Quest. But that blood test is a lipopolysaccharide made by bad bacteria in your colon. And what they found was that if your blood levels of TMAO are high, there is a direct high exponential correlation with developing heart disease. And what they found was this particular protein was made by bad bacteria that comes from animal products. So a lot of times when my patients come back with high TMAO levels and they have heart disease, I try to get them to shift their diet to a more plant-based diet And if they are going to eat animal products, I try to get them to do well-sourced, grass-fed, organic, clean animal products, because we find that what the animal eats is in their tissue. And then when we eat their tissue, it becomes part of our tissue. So that test is TMAO, and it's by Cleveland Heart Lab. But if you're looking for gut microbiome testing, you can get stool testing through Genova Labs. That's the labs that I use. Now, I don't have any affiliation or any payments from any companies, so I don't have any reason to recommend any particular lab, except for I like this particular one because it does really well. But Genova Labs, you can order a test kit, put a stool sample in there, send it off, and then they will provide you with a full report on how you're doing in terms of your gut health.
Awesome. I did have Nini say, she mentioned, thank you. She said, thank you for all the recommendations on small intestinal bacterial overgrowth.
Good.
It's from Nini. Okay, so unless any of you have questions, you can drop them below, but we're going to start wrapping up unless those questions come in. We are going to revisit something that, let me backtrack a moment. Yes, we wanted to expand on diaphragmatic breathing because that with pelvic floor and the endo community is huge. So if you could expand some more on that, that would be wonderful.
Absolutely, I love it. So the vagus nerve starts in your brain. It's the longest nerve in your body. It's cranial nerve number 10. It originates in your brainstem. It goes through your throat. It goes through your heart and your lungs. It goes through your diaphragm. Productive organs and actions. You know, you don't have to think about having a menstrual cycle. You don't have to think about producing urine. You don't have to think about digestion. How does that happen? That vagus nerve is what regulates that function. When the vagus nerve gets downregulated through fight or flight, it causes disruption all along the way, including the pelvic floor. Here's the magic of the diaphragm. It's the only muscle where you can have conscious and unconscious control. You don't have to think about breathing, you're breathing all the time, but when you want to, you can actually use that muscle to take deep breaths. The magic of that is that vagus nerve pierces through the diaphragm. And when you actively use that diaphragm, you're stimulating that vagus nerve. And you're actually auto-regulating all the functions of that vagus nerve, including pelvic pain, including pelvic function, and all the muscles in your pelvic floor. Your uterus, your pelvic floor muscles, your bladder muscles, your gastrointestinal muscles, your organs, all are regulated through that vagus nerve. When you take a deep breath in through that diaphragm, remember that glass of water where you take a deep breath and you fill up the bottom to the top? You're filling your belly with air, then your chest up to your neck with air. And then when you expel that breath, you expel it from the neck to the chest to the belly. You expand your belly like a beach ball when you take a deep breath in. And then as you exhale, you pull that navel to the spine. The longer your exhalation phase, the more massaging of that vagus nerve. And the more massaging of that vagus nerve, the more vagal tone, which will then counter the fight or flight reactions, which is causing stress to those organs. So if you have stress and inflammation and tightening of your pelvic floor, and you find yourself in distress with cramping, do some simple 6 to 8 diaphragmatic breaths. And what you're doing is you're changing the chemistry in your body. You're changing the nervous signal to those pelvic floor muscles, and you're actually changing the dynamics and relaxing them. So it's a great magical free tool to relax that pelvic floor. So thank you for bringing that up because it is a very important tool.
Absolutely. We have some other questions that came through if you have time, Doctor.
Yes, of course.
Okay, so Amy says, do you feel, or asks, do you feel there's an amount we are born with, an amount we experience in life, lifestyle trauma chemicals that are equal to an individual combination that will manifest differently in each of us?
Yeah, absolutely, Amy. So you inherit your parents' trauma. Whatever your parents or grandparents endured gets translated into their tissue and gets translated into their genetic makeup. You inherit that. So if your mom was traumatized when she was pregnant with you, or endured stress, or you endured stress during the delivery phase, or you endured stress in the first days of life, all of that is carried forward. And we all are different in how quickly we can dispel toxins from our body, and how we hold on to toxins in our body. So what the studies show is that when children experience trauma early on, their bodies develop differently than children who did not experience trauma. Their upregulated stress receptors, their upregulated amygdala in the brain that detects stress is physically larger than other children. And the part of the brain called the prefrontal cortex that shuts down their stress response is underdeveloped. Their emotional stability, their cognitive executive functioning, their ability to decrease their stress response is actually underdeveloped. So they are more hypervigilant. They are always nervous. Everyone else seems calm. They can't shut that fight or flight down. They may have more trouble with sleep and nightmares as a child. They may have a perfect life, but still find themselves fragile to stress, because that early onset trauma set the tone for their bodies to develop in this way, differently than their friends and their colleagues. Now, what ends up happening is that they continue to foster that same mindset, because they've never really recognized that trauma or worked through it. So what you practice, you make stronger. So you continue to upregulate that amygdala and the sympathetic tone. But here's the magic of the body. What you practice, you make stronger. So if today you've learned that you can change your body through your thoughts and your actions and your lifestyles and the people around you, then that is the first step to changing that dynamic. And you can change. Epigenetics is the study of changing your genetics based on your environment. So you can actually upregulate that prefrontal cortex that might have been underdeveloped because of previous trauma. They've done studies on monks, and their prefrontal cortex after meditation is physically larger than the rest of the population. So our brains are constantly changing. Neuroplasticity is the ability for the cells to constantly regenerate. And if you continue to practice mindfulness and gratitude and prayer, meditation, spirituality, connection, community, purpose, nutrition, sleep, self-care, that part of the brain will continue to grow. If you activate that vagus nerve through diaphragmatic breathing on a regular basis, that vagus nerve will turn into a rope, will turn into a road, will turn into a highway, a superhighway, an intergalactic highway, and it'll become so strong that you can do diaphragmatic breathing in a shopping mall at Christmas time, okay? So it's really that, yes, you are built with this predisposition, and unfortunately you may be handed a book of life that wasn't perfect. Your genetic code may not have been optimal. You may have setbacks, but you are still the master of your universe, and continue to act towards that. Keep doing those small steps to change the message that 50 trillion cells are hearing every single day.
That was great. Thank you. Okay, so we have another one. We're heating up. So Ellen asks, what are your thoughts on estrogen from certain foods?
Yeah, so I talked about it a little earlier. Unfortunately, there are xenoestrogens. There's two types of estrogens actually in food, and I'll talk about both of them. Xenoestrogens are basically foods like animal products, dairy and meats, that where the animals were injected with hormones to increase milk production or increase breast size or body size. So these hormones get actually transmitted into the meat. And when we consume these meats and dairy products, we could get extra estrogens in our body. Also, I talked about xenoestrogens in chemicals. They're doppelgangers, like BPA in plastic. So if you're drinking out of plastic water bottles, you're getting a lot of BPA in your bloodstream. If you're eating foods that are sprayed with pesticides, if you're eating a lot of farmed fish with dioxins and PCBs, or you're not careful about your skincare products and you're applying a lot of chemicals that have parabens and sulfites in it, you're going to get these estrogens into your body that look like estrogen but act badly. and they attach themselves to estrogen receptors, causing imbalances in estrogen and progesterone. So you might think you have a progesterone deficiency when in fact you may actually have an estrogen excess. And that estrogen excess isn't coming from your production, it's coming from your consumption from the environment. Progesterone is the mother of all hormones. So when you consume cholesterol, that cholesterol gets converted into progesterone. Most people don't know that cholesterol is what hormones are made of. But that's the food that makes estrogen, testosterone, and progesterone. So cholesterol gets converted to progesterone. Progesterone that gets converted to either cortisol, which is your stress hormone, or it gets converted to testosterone and then estrogen, your sex hormones. So let's say you're enduring a lot of stress, or you've come from a place of trauma that you haven't worked through. Your body innately will take that mother progesterone and convert it all to cortisol, to put you in fight or flight, in hypervigilant state all the time. And with rising levels of cortisol, you will actually see a decreasing levels of progesterone, estrogen, and testosterone. So the problem isn't supplementing these hormones, it's balancing the stress to take the body's shift away from cortisol and putting it on sex hormones. Let me put it simply. If you're a rabbit and you're being threatened by a pack of wolves, you're not going to try to find a mate and reproduce. Your reproduction will shut down and your stress response will heighten. So when we're in chronic stress all the time, we're racing our children to school, we're working hard, we're trying to balance work-life balance, we're dealing with physical ailments, we're dealing with physical pain, all that causes our cortisol levels to go up, and it causes an imbalance in progesterone, estrogen, and testosterone. So yes, you can get it from foods. Now, that's the not so healthy estrogens you can get from food. People always ask me about phytoestrogens, which are estrogens you get from plants, whether it's yams, soybeans, sesame seeds, tofu, soybeans, I said that once. And I find that studies have now supported that when you get phytoestrogens from plants, they actually act in a healthy way in the body as opposed to unhealthy estrogens. And I know that that's confusing, but when we talk about breast cancer, for instance, breast cancer, estrogen-driven breast cancers are actually the lowest in countries that consume the most soy. So Japanese women and China have the lowest or the highest rates of breast cancer and estrogen-driven cancers. So we're finding that estrogen in food isn't all alike. Plant estrogens actually may have a protective effect, may actually be more healthy for us. Flaxseed, soybeans, sesame, yams, these things may actually have a protective effect. And these other xenoestrogens, these doppelgangers that are in our chemicals and our food products, may have a pathologic response on our food. Now you may say, this may be going down into a rabbit hole a little bit, but you may say, why? Because there are two types of estrogen receptors in the body, alpha and beta, okay? Alpha accelerates inflammation and disease. Beta puts the brakes on inflammation and disease. So if you have a plant estrogen that attaches to a beta receptor, it actually may be anti-inflammatory. And if you have a doppelganger, an xenoestrogen from a chemical that attaches to the alpha receptor, it's going to upregulate inflammation and cancer and diseases. So it's not as simple as cut out all phytoestrogens from your diet. Be mindful that estrogen in your diet may come from healthy sources like plants and come from unhealthy sources like chemicals, additives, foods, hormones that are injected in animals. Does that answer the question, Brittany? I think I lost where.
No, it absolutely did. If you're not clear, please, they can let us know, but I totally was with you.
Okay, good.
It's a great explanation. I love your examples and how you speak in our terms too, so we can understand you. You're wonderful. Okay, so we do have another one. This looks like the last one.
Okay.
Amber asks, do you have any advice for low libido after dealing with pelvic pain?
Yeah. So women, we are very complex. It's definitely not a silver bullet answer. It comes from how we feel about ourselves, how we feel about how we look, how we feel. Pain causes a visceral response. It's connected to our psyche. So if you've experienced pain, the body doesn't want to re-experience pain. So it causes us to tighten up. It causes us to avoid. And that's a natural response. So if you've gone through trauma, if you've gone through surgeries, if you've had pelvic pain, and now you find yourself not having the desire to be intimate, that is a natural response. You're very, very normal. Anybody in your situation would feel the same way. So what happens is it's getting comfortable with yourself again. It's doing what we talked about before, is acknowledging that the body is yours, that she is lovely and beautiful just the way she is, and breathing through things and relaxing the pelvic floor. Having an open relationship with your spouse or loved one and communicating about your insecurities and your vulnerabilities, allowing that person to know it's not them, it's something you need time for, and allowing yourself to then cultivate a safe environment. Because if you feel threatened by that interaction or you feel pressured into that interaction, it's not going to help the situation. But if you feel safe, protected, and loved, and you feel understood and validated by your significant other, then you're more likely to engage in other activity and want to engage. Because remember, it's all up here too, not just down there. And then getting comfortable with the pelvic floor. So there are some yoga poses, if you like yoga. There's some yoga poses that can help you, get comfortable with your pelvic region. We call it the second chakra, right? So it's orange in color, actually. So the orange color is the pelvic chakra. It's the chakra right below your belly button. That is the color of your reproductive organs. So breathing and relaxing and meditating on that orange color. For me, I think of it as the crust of the earth. So when I'm sitting and I'm doing chakra meditations, I think of the seat as red, which is the core of the earth. And then my reproductive organs is the crust of the earth, which is orange in color. And then the middle part is the sun. It's where my energy, the yellow color is the middle chakra, Ram. And then up here is the heart chakra. It's the color green. It's opening up to the rainforest. The throat chakra is the ocean, so unconditional love. The third eye is the indigo or purple chakra. I think of that as space and galaxies and stars and infinite wisdom. And then the top of the head is white, so white light. So think of your pelvic floor and your chakras and your breathing and your breath work and your relaxation as part of getting comfortable with intimacy and talking to your spouse about your insecurities and vulnerabilities, and getting to know yourself physically, and also setting boundaries. If it's not in your nature, if you're not ready for it, and it's not something you want to do, perfectly okay and natural and normal. Give yourself permission to fight with fierce passion for yourself in whatever way that suits you when it suits you. So there's no requirements that you should put upon yourself when you're not ready. So yeah, and then on the medical side of things, Brittany, if somebody feels like they are having trouble with vaginal dryness, or they're having trouble with stimulation, or they're having trouble with lack of nerve stimulation, sometimes I will recommend bioidentical topical hormones, whether it's testosterone or DHEA applications, to help stimulate the nerve endings. So if it's more just the lower half is not as robust as it used to be, then I will recommend topical applications of hormones to allow for that.
Okay. May I ask for you to answer a couple more questions that just...
Of course.
Okay. I promise we won't keep you all night.
Oh, that's all right.
Okay, so Lisa, she asked, I have endo and PCOS. Do you know of a direct correlation with those who have endo and PCOS?
So as you all know, endometriosis is when the endometrium grows outside of the uterus, and PCOS is when the estrogen progesterone balance is off, and there's an excess amount of androgens, which is testosterone production in the body. How are they connected? So we talked about the root cause of all disease being inflammation, right? Inflammation sets the tone. We talked about the gut being sort of that seat of all health. So let's see how that connects. When you have PCOS, it's not really about estrogen, progesterone, and testosterone. Do you know what hormone is is clearly linked with PCOS? Insulin. Insulin is the root cause of PCOS. So if you have insulin resistance, what that means is your body isn't able to register insulin and get sugar into the cell. The sugar rises into the bloodstream, and that sugar is inflammatory. And if the canary in the coal mine for you is your ovaries, that's where inflammation sets in first. And that high inflammatory state shuts down your ovarian production, okay? Because there's a high amount of stress from that inflammation. Your adrenal glands that make stress hormones is hyperdrived, right? So it's upregulated. But guess what also is produced in your adrenal glands? Your testosterone. So your adrenal glands are charged up from being stressed, from the inflammation, from the sugar, from the insulin resistance. And now guess what happens? Your estrogen and progesterone levels are all shut down. So now you've got this imbalance of high androgens and not enough progesterone, not enough, cycling, irregular cycles. Now, the second thing that she asked was, but what about the endometriosis, which is an estrogen dominant disease? Well, we talked about how xenoestrogens, xenobiotics, exogenous stressors can cause disruption of the estrogen progesterone balance. We also talked about how high cortisol, meaning the adrenals are hypercharged, progesterone goes towards cortisol and shuts down towards the sex hormones. So you can see how stress can play a role there too. Lastly, if you do have heavy menstrual cycles and you need, some relief from that, then yes, see your endometriosis specialist, see your surgeon, see your gynecologist, take the medications that they recommend to try to create that balance. But while you're doing that with them, walk yourself back. Work on the insulin regulation, work on lowering the cortisol, which is the stress hormone, work on nutrition, resetting the gut balance, decreasing inflammation from food that may not serve you, trying to get sleep because that helps restore balance. During that 8 hours of sleep, that's when the body resets hormones. So if you're not sleeping, your hormones are not going to reset themselves, which is going to cause disruption too. So going back to that thumbtack rule, it's really never one simple thing that connects everything. It's a web. Disruption in cortisol and adrenals causes an excessive amount of testosterone, and high levels of insulin causes high levels of cortisol, which high levels of cortisol causes decrease in estrogen and progesterone. It's an orchestra. The body's an orchestra. Every organ and every tissue is talking to each other. And if one is distressed, then it causes stress in the others. So if you were trying to work on PCOS and endometriosis, my first suggestion is work on the adrenals and work on the gut. Right? And if you can create balance in those two things, you might just start seeing some small shifts in everything else.
Okay, last question, doctor. And this one is an opinion she is seeking of you. Ellen, she asked, do you think estrogen has got a too big of a role in explaining of the disease and choice of treatments by doctors?
Yeah, absolutely. So just like I said, she's right on the mark. We get so pigeonholed and siloed that the answer is just one thing, and it's not. And we also think that the treatment is just one thing, and it's not. Our body is a complex web, and every tissue, every cell, every organ has this role to play. And if we only focus on the flutes and we forget the drums, we're really going to miss the boat on this orchestra. So we need to really kind of step back, look at the forest, not get caught up in the rabbit holes and the trees, but look at the forest, see where we came from, what is our timeline, when did we last feel good, what was the perfect storm that put things into play, what can we do to start marching our way back and taking steps. And the journey is never a straight line. It's more like this. And not everybody has the right answer, and not everybody has the same answer. So you may try a diet and it doesn't work for you. You go completely keto and it didn't work for you. You went completely vegan and it didn't work for you. You cut out gluten and dairy like your friends did and it doesn't work for you. And you find that you're struggling with that. You may need to work with an integrative physician to help navigate your unique thumbprint, your unique blueprint, your unique path to wellness. And as you journey through that, stay calm, breathe, love yourself along the way, because if that process causes you stress, it's causing an imbalance in your adrenals again, right? And that's causing that cascade of inflammation. So even through this journey which you're going through, be calm, breathe, be loving towards yourself, being accepting of everything that you've gone through, knowing that you're a survivor, that you're a thriver, and that you deserve everything that everyone else deserves. Yes? So that's my advice there.
I love it. So doctor, tell us how everyone can connect with you.
So my website is Aims for Wellness, AIMSFORWELLNES.com. That's my website. But they can find me on social media. I do videos on health topics all the time. I have a YouTube channel, which is Jyoti Patel MD. My Facebook page is Jyoti Patel MD, and Twitter, I'm Jyoti Patel MD. My handle on Instagram is J Patel MD. And I do run a Facebook group called Patel Wellness Community. It's where I share recipes, medical information that's evidence-based. I might run a 3-week detox or 3-week anti-inflammatory or 3-week something to help people get jump-started into their wellness. And I love your community, Brittany, because I feel like when you create community, you really create a nice home for people, and that really elevates wellness in a big way. So congratulations to you as well.
Oh, thank you. It's a good community with incredible souls, and we're all seeking wellness. So we thank you for taking the time out of your busy day to speak with us, and it's been wonderful.
Thank you so much. I'm honored that you asked me to speak. And if anybody has any questions, please don't hesitate, if you're watching this after the fact, to put them in the comments. I'd be happy to respond in any way.
Thank you for offering that. Well, everyone, that's all we have for you tonight on the Endo Channel. Dr. Jyoti Patel, thank you again. We'll see y'all soon.
Thank you.